Hi, I'm Nate, a doctor working in gynecology. In this video, we're going to talk about cervical cancer. After my foundation training, I worked in a gynecological oncology unit in London, and one of the most profound experiences happened during my first shift. I was called to review a woman in her late 30s with abnormal observations, suggesting that she was very unwell. She had advanced cervical cancer and sadly passed away, leaving behind her husband and young children. It was extremely tragic, and that experience left a strong imprint on how I would practice medicine as a doctor. Cervical cancer is the fourth commonest cancer in women, affecting 13 out of 100,000 women worldwide. In the UK, 3,200 women are diagnosed with cervical cancer each year, which means 9 diagnoses per day, more than half of which are diagnosed under the age of 45. The cervix, which some call the neck of the womb, is a part of the reproductive tract which connects the womb to the vagina. It has two parts to it, the endocervix and the ectocervix, and they are lined by different types of cells. The junction between the endocervix and ectocervix is where new cells are constantly being reproduced. Because of the high activity within this area, there's a higher chance of abnormal cells appearing. When these abnormal cells spread, they can become cancerous. The human papillomavirus is associated with 99% of all cervical cancer cases. There are more than 100 different types of these viruses, but there are two main ones, HPV-16 and HPV-18, which are likeliest to cause cancer. Other risk factors for cervical cancer include being heterosexual, having multiple sex partners, smoking, being in a lower income bracket, having a weakened immune system such as living with HIV or being on certain medications, not attending a cervical screening program, and there's a slight increase in risk for people taking the combined pill. As cervical cancer has a precancerous stage, which can be easily identified and managed, there are two great ways to prevent cervical cancer. 1. Complete the vaccination course. This limits the risk of getting the HPV infection. The second is to attend the cervical screening program regularly. This allows us to identify women at high risk of developing cancer in the future, and if needed, provide treatment. The commonest symptom of early cervical cancer is abnormal vaginal bleeding. This can happen in between periods or soon after intercourse. Other symptoms include abnormal vaginal discharge, vaginal discomfort, or discomfort when passing urine. With advanced disease, people may notice blood in the urine or having to urinate more frequently. They may also notice fresh blood from the back, altered bowel habits, swelling in one or both legs, and discomfort within the pelvis. When a person has symptoms, we will start with performing a full pelvic examination. This will include a speculum examination to look at the cervix and the surrounding vaginal tissue, and an internal examination whilst feeling the abdomen. This allows us to identify other causes of bleeding, such as a cervical ectropion, a cervical polyp, or a possible sexually transmitted infection like chlamydia. Therefore, we would also recommend a sexual health check. Copposcopy is the next step on the investigation ladder. This allows us to have a very close look at the cervix with magnified lenses. This helps us identify potential precancerous tissue or even cancer. We may stain the cervix with solutions like acetic acid, which is vinegar, and so may sting a little, or with brown iodine. These solutions will show a contrast between normal cervical tissue and abnormal tissue which may not have been visible to the naked eye. We can also take specific tissue biopsy during colposcopy, which can then be looked at under the microscope. If it is cancer, the pathologist can tell us what kind of cancer it is, and we will recommend further imaging of either a CT or MRI scan to look at whether the cancer has spread and to which organs. Managing a cancer diagnosis requires a multidisciplinary team. This can involve doctors specializing in chemotherapy and radiotherapy, surgeons, cancer care nurses, histopathologists, and radiologists. They all have specialized knowledge to provide the optimum care for people diagnosed with cancer. The type of treatment offered will differ depending on several factors, including the type of cancer, the spread of disease, one's current health status, and of course, patient's preference. The team will discuss the pros and cons of all available options, the potential complications and side effects, and if the aim is to cure the cancer, the success rate and prognosis. If the disease is microscopic, we may offer a LET procedure. This is when part of the cervix is removed. This can be achieved with numbing injections in the outpatient department, but can also be performed as a day case whilst asleep. Women receiving this treatment are at an increased risk of early births, and so will require additional scans when pregnant. For disease that is within the cervix and the tumor size is still small, and the woman wishes to be pregnant in the future, the team may offer a trachelectomy. This is a procedure which involves removing the entire cervix and the womb is reattached to the top of the vagina. There's also a high risk of preterm birth after surgery, and so your surgeon may recommend a procedure called a cerclage to minimize this risk. In more advanced disease, or if the person does not wish to be pregnant in the future, we propose a hysterectomy, which involves removing the womb, the cervix, and the fallopian tubes. Radiotherapy involves using radiation to target the cancer. It may be offered after surgery or as an alternative to surgery for people where cancer is still limited in the pelvis. It can also be used in people with advanced disease to help with symptoms like pain. Chemotherapy involves using medications to kill cancer cells or to stop them from multiplying rapidly. It can be given before or after a hysterectomy, as an alternative to radiotherapy, as a standalone treatment, or with radiotherapy. The outlook is best when cancer is only found within the cervix, where cure can be successful in 8 to 9 out of 10 women. A lot of these therapies can come with terrible side effects, some of which can be long-term. Therefore, living with cancer can be difficult, but support for different factors are available to improve one's quality of life. They include sex therapy and counselling, social workers, as well as hospice care, GPs and district nurses. I've included links about support access and information about cervical cancer in the description below. Give this video a like if you found this helpful. Share this with people whom you think will benefit, subscribe to the channel, and I'll see you again soon.